Hello, good morning, and welcome to yet another very important of the dialogue series by the NCCE. And as you have followed the NCCE, they have been playing a major and very important part in making sure that you are fully educated about what is going on as far as coronavirus is concerned. This is yet another occasion where the NCCE not only engages you, but seeks to bring you expert education and advice as to how to conduct your life. Once again, welcome. This is the 5th National Dialogue. It's done each quarter and based on research that is conducted by the organization with a constitutional mandate to give you education. So welcome to the 5th Arab National Dialogue by the NCCE. You can find us hashtag NCCE Dialogue on Joy, hashtag NCCE Dialogue on Joy. Thank you all so very much. We will straight away get to hear from the NCCE's chairperson and a few other very important stakeholders in this morning's dialogue. So let's begin by having an address by Ms. Josephine Nkrumah, who is the chairperson of the NCCE. Hello, welcome, Ms. Josephine Nkrumah.
Well, thank you very much, Samson.
Great. So let's hear you right away. Why is today yet another important occasion for all of us as Ghanaians tuning to the NCCE's 5th Arab National Dialogue?
Distinguished virtual audience, good morning. As we all know, in the last 6 months, our world has changed, perhaps irrevocably. However, the resilience of the human spirit ensures that we continue to pursue our objectives, both as individuals and organizations. It is on this note that I welcome you to the NCCE's 5th Dialogue in our Accountability, Rule of Law, Anti-Corruption, and Environmental Governance Dialogue Series. This 5th dialogue focuses on good environmental governance and the coronavirus pandemic. Whilst we continue to grapple with the immediate charge of containing the spread of the virus and saving lives, we must remain alive to other adverse impacts of the pandemic. COVID-19 undoubtedly highlights the essential role of plastics in our daily lives. Disposable masks, PPEs, gloves, and other essentials to ensure we minimize infections across the broad spectrum of activities of living and working. There is a surge in the demand for plastics with the resultant issue of sustainable waste management, including medical waste. More worrying is the growing challenge of handling waste, particularly where it is alleged that in certain suburbs, people are collecting used masks and washing them for resale. In certain communities, young children are vulnerable as they play with indiscriminately disposed masks, gloves, etc. We need a dynamically responsive waste management system that takes into account proper segregation of household and workplace waste, particularly due to the potential or real infectious nature of such waste? How are our public institutions and public-private partnerships responding to these challenges? And how are we, the citizenry, playing an effective role in these matters? At the end of this dialogue, it is our expectation that our takeaway will encourage us all to adopt a more environmentally sustainable lifestyle, uphold the value of integrity, even as we are challenged to demand accountability from institutions operating in the environmental governance sector. As we deliberate on these issues, we should, as a country, be upscaling our green financing models that tackle issues of deforestation, sustainable environmental business models that can address the surge in unemployment
Right, so a bit of technology difficulties there, but I'm sure that we should have that quickly rectified, and then Ms. Josephine Nkrumah can finish up with her welcome address. But she's done substantially what she needs to bring all of us on board to get to understand about today. It is the 5th virtual Arab National Dialogue. The theme is good environmental governance and the coronavirus pandemic. We have experts who will help us to understand what is going on and how we need, in the midst of the pandemic, to take care of the environment in a way that we don't unnecessarily get into the risk of getting infected. If Ms. Nkrumah's line is clear and clean now, can we have you finish up your address? Okay, so we're trying to get that immediately sorted, and once that is done, we will have it. And once again, don't forget, this is the National Commission for Civic Education's quarterly dialogue. Is a national dialogue based on empirical evidence brought from research that the NCCE gathers. Let's have the chairperson of the NCCE conclude her welcome remarks.
Well, as I was saying, as we deliberate on these issues, we should, as a country, be scaling up our green financing models that tackle issues of deforestation, sustainable environmental business models that can address the surge in unemployment and the widening socioeconomic inequality in society, particularly for women entrepreneurs in the wake of this global pandemic. I take this opportunity to thank our moderator, Samson, and the panelists for joining us for this dialogue as we explore critical issues of environmental governance in the wake of coronavirus. Of course, this dialogue would not be made possible without our funding partner, the European Union, as well as our media partner, the Multimedia Group. The Commission is indeed grateful and cherishes these partnerships we have built over the years. I look forward to an informative and insightful dialogue. Thank you very much. Over to you, Samson.
Thank you very much. Ms. Josephine Nkrumah is the chairperson of the National Commission for Civic Education, the NCCE, and the NCCE has been playing such a very important role in making sure that you get the needed education about the coronavirus pandemic so that you can reduce the risk of contacting the virus. And as she just mentioned, this is made possible by their partners, the European Union. And this is always done in partnership with the Accountability Rule of Law and Anti-Corruption Program, ARAP. Now, as she mentioned, the European Union is a very significant partner in this. Shall we, at this point, welcome the head of the EU delegation to Ghana, Her Excellency Dinah Akonsia for her statements. We would first have to have the EU delegation, the head of the EU delegation to Ghana, Her Excellency Dinah Akonsia. Right. In the meantime, whilst we get ready to have her, let's have Mr. John Poamang, who is the acting executive secretary of the EPA, the institution that is critical to ensuring that our environment is clean for our protection, for his remarks. Hello, Mr. Poamang.
Yes, thank you very much, moderator, and your panelist, the chairman of the National Commission for Civic Education, the head of the EU delegation, and the representative of the Arab program, the multimedia group, distinguished ladies and gentlemen. It's a pleasure for the EPA to make some remarks on this occasion of the 5th dialogue on environmental governance, which focuses on environmental governance and the COVID-19 pandemic. You will agree that since 1992, when with the Rio Declaration was made, many countries all over the world set up environmental governance institutions. And in Ghana, the EPC at that time was set up, and then finally it became the Environmental Protection Agency, to, among other things, coordinate environmental governance activities in Ghana. And we are glad that groups like the Arab and the multimedia group are collaborating with us, to bring this critical issue, to national attention. That is the way with the COVID-19 pandemic, is affecting environmental governance. We, as people, we have failed to recognize that, at the end of the day, the health of the people, depends, largely on.
Okay, so we're getting a bit of a difficulty with Mr. John Poamang, the Executive Director of the Environmental Protection Agency's also line, but I understand that he's clear now. So, Mr. Poamang, you can continue.
Thank you. And mostly due to our human activities that we have been in terms of deforestation, intensive agriculture, unsafe management, and then consumption of wildlife and natural resources. These are what we are doing to undermine the ecosystems, that are there to protect us. The COVID-19 crisis, was caused, by a combination of harmful interactions between humans and wildlife, and then also, the accelerated movements of people and goods across borders. This, interaction between humans and wildlife, led to the spread of the disease, but also the movement, large movements of people using, air travel and other forms of movement caused the disease to spread very quickly, to pandemic proportions. So we as a people have to look at what, we are doing that is causing all these pandemics. And I think in the history, we can recount so many of such types of pandemics. But while the COVID-19, pandemic is tragically affecting people's health, lives and livelihood, it has also noticeable positive impacts in that due to the restrictions that are being imposed to control the spread of the disease, movement of vehicles and so forth are reduced. And so air pollution has sort of improved a little bit, not so significantly, but at least there's some marginal improvement in air pollution due to people not moving so much, and also industries not producing at optimal levels. But we also know that the pandemic has brought in its wake other forms of, other types of environmental problems, notably, the waste that are generated, healthcare waste. We have got different types of healthcare waste which are emanating now, and also, the face masks, the disposable face masks that we have to deal with, as well as the numerous plastics that are used, to contain the hand sanitizers that we are all using. We also have a lot of disinfection going on using chemicals, and some of these, have got undesirable side effects. So these are also some adverse effects of the, pandemic that we can talk of. But we have to realize that in the short term, we need to have some very strong systems in place to manage the healthcare waste that are emanating from the control of this pandemic. And for this, the waste collection companies, or even all the various individuals, have to take steps to make sure that, the used masks are not disposed of, anyhow. These are wastes which are potentially, infectious, and so we need to make sure that we dispose of them properly. And also, we need to change our lifestyles. Now we are doing this conference, using, a Zoom application. We would have met together somewhere in a hotel to do this program, but now we all have to make sure that we get used to this type of programs, that we do, things in this manner. And going forward, we need to make sure that we change our lifestyles to suit the way the pandemic has brought us to this point. And then, as we go along, many countries, including Ghana, are taking steps to try to, improve upon the economy by coming up with some, packages. And in doing these packages, we need to make sure that we are doing the packages to try to get industries to come back using green, economy principles, not to go on in the same way that we used to do, with polluting and so forth. Industries, as they go on to try to, revamp themselves, should go through the green, route, so that we can control, environmental damages that we are causing, some of which have led to this pandemic. So on this note, we thank the Arab, for supporting, this dialogue, and also the multimedia group for providing the forum for us to participate, the National Commission for Civic Education, and we look forward to the, panelists and then the rest of the program. Thank you so much.
Very much indeed. Mr. John Poamang, who is the Executive Director of the Environmental Protection Agency, and who has always been available, particularly when the NCCE has to give education on environmental issues. And please don't forget, today we are looking at good environmental governance and the coronavirus pandemic. Good environmental governance and the coronavirus pandemic. This is the 5th Arab National Dialogue by the NCCE. So now we will get straight into getting some education, getting to discuss the matters that really matter. So we will all be assisted in how we ought to handle our waste so that we reduce the risk of infections. And here in the studio to help us do this discussion is Dr. Imani Africa, who is the Director of Policy, Planning, Monitoring, and Evaluation at the Ministry of Health. Doc, thank you very much for making time to be with us on this dialogue.
Thank you, Samson.
Great. And also is Sanam Tenge, who is an engineer and manager, Medical Waste Department of Zoom Lion, the biggest waste management institution when it comes to this country, and even some parts of Africa and West Africa. They have such a big name in helping to take care of our environment. Thank you very much for joining us, Sanam.
It's a pleasure there, Samson.
Right. We will be joined on Zoom by Mr. Franklin Kujo, who is president of Imani Africa. So Mr. Franklin Kujo should join us sometime shortly. But as you know, we are looking at the environmental situations, COVID-19, prevention and safety protocols. How are you exactly following them? And as Mr. John Poamang of the EPA just mentioned, the matter of disposal of medical waste, including nose mask, hand gloves, medical overalls, and tissues in order to contain the spread of the virus. We're having children who are likely to be exposed as a result of that. So we're looking at the questions of child safety and advised to stay away from playing with used PPEs. How are you dealing with your PPEs in your home? I've seen people who just pick their mask and seem to throw it anyhow. How can you do it and do it well? Waste management services and the handling of waste as well. So let me begin with Dr. Odame. First of all, must we be concerned about waste, particularly waste as a result of the pandemic in our society, in our homes, and the country at large?
Yeah, so thank you, Samson, for the opportunity, and thank you to the good people in NCCCE for organizing this very important forum. I always keep on saying that if you do the right thing at the wrong time, it's wrong. And if you do the wrong thing at the right time, it's equally wrong. So getting
the right thing at the wrong time,
is wrong.
That is wrong.
Yes.
Okay.
And if you do the wrong thing at the right time, it's also wrong.
Okay.
So getting the right thing being done at the right time and at the right place is what makes it right.
Right.
And I think the timing is apt for this occasion.
Great.
Because society is grappled since the Spanish flu. We are grappled with one of the most major. Also, who knows? Maybe this is maybe the Third World War. The most major pandemic that has grappled all nations that we confront on a daily basis. And you ask the question, is environmental governance important? Absolutely. Why am I saying that? Clearly, we are generating infectious waste at an alarming rate. If you care to know, PPEs are one of the items we bought most importantly as part of this weapon, against the arsenal against this battle. And I'm sure in Joy FM studios, you are very clear that almost everywhere facilities are asking for PPEs.
That's right.
I say it has become like the major weapon for the battle against coronavirus. Not just PPEs alone, the coveralls, the face masks as we're wearing, all the various things we're asking for. And this clearly points to the fact that if we're generating X number of waste prior COVID, today is SQ. So clearly, it's important, it's come at the right time, and how we confront it is key. Thank you.
Let's have also Sanam, who is the engineer and who oversees a department in such an important institution in the waste management process in this country, like Zoomlion. Tell us, what are we looking at when we talk about waste within coronavirus, the coronavirus pandemic at this time?
Okay. I'd like to begin by saying thank you to NCCE, Arab, EU, and the multimedia for such a platform like this to discuss such an important issue. I also like to say good morning to our executive chairman and then Mrs. Labi, our CEO, and the management of Zoomlion. Yes, with regards to your question, actually what is actually happening is that this COVID-19 pandemic has brought a lot of difference in terms of the type of waste that is being generated now. Now we have the infectious component of the waste actually increasing, escalating. Before COVID, research indicated that 15 to 25% of the waste that was being generated, especially from healthcare facilities, was infectious. Okay. Now we have this percentage increasing to about 40 to 50% due to the increase in the PPEs being used, the test kits. Now we can see numerous testing being taking place. Now all this has increased the infectious percentage of the waste that is being generated. And now it implies that there's supposed to be a capacity of technology being brought in place that could actually handle such a waste. But it's unfortunate that in Ghana, we do not have such a capacity. We only have one centralized medical waste treatment facility in Accra here, serving the Greater Accra region and a few of the regions around us, Volta region and the Eastern region. Now looking at this, it's presenting a challenge to us because the other regions are disadvantaged. They also need such a facility to help them out because they are also experiencing the coronavirus pandemic. So now with this, it's a call to attention that something needs to be done immediately for us to be able to contain what is actually happening. Otherwise, the situation might be worse.
All right. Franklin Cudjoe, who is the president of Imani Africa, joins us via Zoom. Thank you very much for making the time, Franklin.
Good morning, Samson, and good morning to your guests, fellow panel members and viewers as well. I'm sorry, I didn't forget. I'd slept. I'm sorry.
All right, so I understand you have a very busy schedule and therefore things can happen. But first of all, what for you is the significance of this discussion? Why must we be talking about good environmental governance and the coronavirus pandemic?
Well, thank you very much. And ordinarily, we should be talking about the environmental governance any day, anyway. It just so happens that because we've been laxed, because we've not taken these issues about environmental governance properly, what it means is that our problems have compounded. As the gentleman from Zoom Lion just said to you, there's been increased use of
PPEs.
PPEs and other related materials, COVID-related materials. And so what it means is that your waste levels, waste management situation has been compounded. And so, yes, it is an opportune time to have a conversation like this because it reminds us of what we've been failing to do all the time. And I'm sure before the program started, you may have related what the president said concerning sanitation and keeping Accra as one of the cleanest cities. I haven't seen any of that happen yet. And so to think that a conversation about environmental governance or management is crucial is an understatement in these very important times. And so that's what I've got to say. But I also have to just add quickly that it looks as if the approach we've been adopting is not necessarily helping us. It looks as if we are overly focused on the public sector trying to solve these matters for us. When waste is an independent problem. And when I say independent, I mean human beings generate waste. And so human beings must be made to account for the waste they generate and pay for them. Of course, public authorities must ensure the infrastructure that should exist in order to safely, manage these waste, or as it were, turn it into some proper use. But to the extent that not many persons see these as a personal decision because the state doesn't seem to give that credence, fiscal credence, and I mean in terms of taxation or in terms of the ability to pay, the state hasn't made it overly mandatory to ensure that persons who generate waste are made to pay for them.
Right.
And so it's become a bit of a conundrum. And I'm sure as the conversation transits, we'll talk about options for optimizing our environmental governance.
Right. And so Franklin Cudjoe brings our attention to a pledge that the president has been pursuing, that we need to make, for example, Accra clean. And we know that the country spends billions in trying to get its act together as far as managing waste in this country, and even in Accra alone is concerned. Nonetheless, we have made very little and minimal success over the period. Now that we have COVID-19 come in and the generation of waste, particularly medical waste, is more than doubled, what are we looking at? Dr. Dami, from where you sit, as you prepared for this particular dialogue, what consumed your attention as to what we should worry about and what ought to be done to remove the worry?
Yeah, so thank you, Samson, once again. I think from where I sit is about the first question that, have we put in place the right policy architecture as a people to allow for this worry to be taken care of? So if you take it from the very beginning, I mean, when I say policy architecture, I'm looking at it from all the various levels.
First, give us an understanding, give us some graphic of how you have, perceived and looked at the reality of the waste that we are generating as a result of coronavirus. And then let's come to talk about whether or not the architecture exists to deal with it. What are we looking at?
So clearly, like I told you, we are generating waste materials now at a very alarming rate across almost our 58 treatment centers across the country, in addition to some isolation centers. That brings it up to about 72. And all this place, you're talking about continuous change of PPEs, coveralls for all the medical staff, even our hand washing devices, sanitizers, disposals, all the various medications we are using for our COVID patients we have now. And for information, as we're speaking now, we have close to 21,077 confirmed cases, and we've had about 129 deaths. So also even talking about our mortuary staff who are working on these dead bodies, moving them in and out and all that, all the things they're also using in there. So clearly, if nothing at all, we've had about 21,000 confirmed cases for all the staff, not to talk about all the real armies we have across from village level to community levels, moving across the nook and cranny of this nation, doing what we call contact tracing. So clearly, this is waste at an alarming rate. Well, the good news is that we are also alive to it, and alive to the fact that we need to put in place the right architecture. So maybe I'll wait for your next question, and then I'll dwell a bit on the policy architecture.
Right.
Is it fit for purpose or not?
The president has given us about 15 or so addresses so far. And at each time, he tells us how much the country is committing to bring in PPEs. As we speak, because universities, senior high school, junior high school, certain categories of students have resumed. They are having to be supplied free of charge PPEs. At least each student is supposed to have 3 nose masks.
That's correct.
That should give us a picture of the enormity of the waste to be generated.
That's correct.
Beyond that, you're talking about the medical officers who have to use most of what they use, which is not reusable.
That's correct.
So that's a lot.
That's correct.
Senam, from where you sit, how can you bring that graphic to home?
Thank you very much, Lawyer Samson. Yes, so looking at this, before COVID, nationally, the whole Ghana, we were generating about 24,224 tons of waste. Now, research has indicated that from the international waste, that 20%, there's a 20% increment of this tonnage of waste because of the COVID. Now, it implies that with this, we need to be alert and tackle the issue head on. If we sit down without doing anything, we'll be taken unaware. Now, this situation has brought to the fact that, especially the infectious component, because we are looking at potentially infectious waste.
Right.
We don't know the person using it, don't know whether the person has COVID or not. When the person is disposing it off, the person just throws it away like a general waste. But then there should be a system in place that to bring about waste segregation. We need to segregate the infectious aspect from the general waste aspect. There's a principle that if you mix the non-infectious with the infectious, the whole waste is regarded as infectious waste or hazardous waste, which implies that all this waste needs to be treated. And when this comes to board, it means that there is going to be higher cost for the waste treatment.
Right.
So the waste segregation needs to be put in place so that we use a little, relatively smaller amount of money to treat that small component as compared to mixing everything up and then treating the entire waste. If we don't do that, it means that we'll be exposing ourselves to the infection.
Right.
And this, as I earlier said, might worsen the case, and we might not know how to even handle the situation.
In April, the president announced that we were going to produce locally 3.6 million of PPEs on our own. This will stay here in this country.
Yes.
We have had medical practitioners and people involved in the medical or health, system suggest at certain points that they are looking for some PPEs and they don't have. I want us to pay attention, to draw our attention to how to manage the waste even in the circumstance. So let's begin and get directly into our homes.
Okay.
What do you have to say?
Okay. Actually, infectious waste management is a chain on its own.
Right.
Okay, it starts from waste generation. So the person generates the waste, for example, nose masks, you use nose masks. Now from waste generation, you go to waste segregation. Waste segregation is where you separate the waste into. It's from dependent, but in our case, we are looking at infectious and then non-infectious. You could go further to plastics, metals, etc. But our focus now is infection because we are dealing with corona.
Right.
Now, in our homes, currently, most of us do not have separate bins for our waste. We just use one bin to collect everything.
Every day I remove my mask and I just dump it into my waste bin.
A liner. So everything is being mixed up. So over there, for example, just to say, if you are positive, it implies that all the waste that will be in it will be contaminated by the nose masks that you place in there, making all those waste infectious.
Oh, I see.
Yes. So it implies that in our homes, we need to get a separate bin for those kind of items. Nose masks, the tissues that we sneeze in, anything that comes into contact with our body fluids, all those things needs to be separated. The same can be applied to the institutions, workplaces, etc. Especially to the health sector. They actually are supposed to do that. Yeah. So from the waste segregation, you go to the transportation of the waste.
No, hold on there. Now, Dr. Adame, I'm in my home. Yeah. I'm removing my mask. And he's saying I need to separate where I dump my mask from where I dump all other waste. All I know is I'm dumping it into the bin. The waste collectors will come and take it, go throw it away. So why should I bother separating them?
Yeah, so something, thank you. But this is the kind of work we've done with, I'm sure it's aware, with the healthcare waste management policy and the guidelines. That was a joint effort to the Ministry of Health and the Ministry of Environment, Science, Technology and Innovation. Yeah. Really, most of the questions you ask borders, even within the remit of the Ministry of Environment, Science, Technology, they had that full remit. So because for the healthcare, where I sit, we are more worried about the health facilities and what goes into it. But what we have agreed in principle is that we had we've done what we call labeling in the guidelines. There's the red, there's the orange, and there's the yellow. The yellow is for hazardous waste, and the red is for very hazardous waste. And then we have the brown. So the principle is that everything, like he's saying, Senam said, anything that has to do with contact of body fluids, especially in our times now, we all know we are not in normal times, as we've all kept on continually saying, has to go into a separate bin, in quotes. Let's say a separate bin, in quotes. And then our usuals, our normal plastics, our normal papers we squeeze in the home should be separate. Because I'm also taking an opportunity to educate Ghanaians. Because it's very crucial, not just for you, but for both of us. Because in that bin, your child, your whatever can push his hand. Because if it's a hazardous waste bin, you even keep it in a place that might not be accessible to the little children who are crawling on that floor. Right. Who don't know what is hazardous and what is not hazardous. They touch anything, anyhow. So that's the principle. So, and that's why I said, so the first principle is the principle of waste segregation. So now if it comes to health facilities, I can make mention of Ghana East. There's a separate container for all the waste that has to do with hazardous waste and includes all the things that has to do with COVID, i.e. the face masks, or